All right, everyone, welcome to our latest edition of Native Strong Weekly Town Hall with Dr. Lyle Ignace from Gerald L. Ignace Indian Health Center. This week we shifted up a little bit. We do have a community health fair this afternoon, so I had to move it around. So the noon start, hopefully not messing up too much people out there. But for those of you who are returning customers, we do have our chat box that you can check out at the top of your screen, probably a little bubble that you can enter questions there. And today we will have a little shorter session, about an hour. So we will try and get to questions at the end, but it may be a little more abridged version of our typical sessions with you this week. With that, I'm going to pass it along. Quickly, sorry, we are also streaming on Facebook Live. So check us out there. Also drop comments there if you have questions. With that, I will pass it along to our lovely moderator and friend, Mark Denning. Thanks, Mark.
Winnabuju and Maganaduk, Nadawe Benezi Indigenous Cause, Namendo Dem, Anishinaabe and Dow, Neopadindo Jaba. Good afternoon, relatives, and welcome to this outdoor kind of nod to the outdoors from me, my part. I'm glad to be here at noon this time. We have changed things up because there are a lot of activities happening at the Gerald L. Ignace Health Center. For those of you just joining us or coming in, please, just a quick review. If you look at your computer screen, fortunate enough to be watching us live, you're going to use your cursor or that little arrow thing you can move around with your mouse or your finger, depending on your ability screen. And you can go to a chat box. If you move it way down to the bottom of the screen, you'll see some different boxes come up. In there, you're going to see a chat bubble. And if you click on that, you'll see this Zoom group chat box come in, which is just awesome. It is there that you can put your questions. Last week was a program on schools and kind of what was the medical community looking at and seeing when it came to our children going back to schools. And again, this is a native to native conversation. So we're really looking at questions, we're looking at input, and one of those things that we got offline last time was this: why is the program formatted the way it is? And we're just about to go into it, and you're going to see it. As urban natives living in the Milwaukee community, a lot of our relatives, a lot of you out there are very mobile. There are ceremonies that are happening. A lot of them have been canceled, certainly to COVID-19. And a lot of us visit, and we travel around the Midwest quite often for those of us that are lucky enough to go to respective reservations and see relatives and friends. Dr. Ignace put together a program so that we can see when we travel and where we travel, to know where we're headed and what's going to meet us there when we get there is very important information. So we do come from all kinds of different areas of the United States, but especially here in the Midwest. So when you see the kind of numbers and figures that are being reported out, that's of help to those of us, myself included, that travel to different areas. And so, you know, look, this is what we're facing, and this is what's waiting for us when we get there. So please bear that in mind when we're looking at the format. There's other reasons for what we do, because we want to know what's happening in Indian country, certainly to our relatives as well, even though we're not there. Lastly, before we begin, please check in with your friends and relatives that may be homebound, make sure they're doing okay. And if they have questions, we're lucky enough to have internet access. We're lucky enough to have a computer to be a part of this program. Thanks for that kind of opportunity, but a lot of us don't. So please be checking in on those folks that don't, and be asking questions for those that don't have that ability to come and watch an informative program like that. So with this, I'm going to turn this over to Dr. Lyle Ignace on my screen above me, and he's going to be giving us kind of a run through, abbreviated, on what's happening in Indian country and with our community of Milwaukee. Thank you, and here we go.
Thank you, Jeremiah. Thank you, Mark, for the introduction. This is week 14, and things are changing as they do from day to day. But I have a lot of information, and I just want to make sure that I get to everything. It is going to be a bit shorter this time, but let's get right into the numbers. So worldwide, 18.6 million cases of coronavirus. That's a 9.5% increase from the week prior. That is trending downwards internationally. Recovered, 11.1 million people have recovered, 14%. That is relatively flat. And the mortality of 701,278, 5.9%, that is decreasing worldwide. Here in the United States, 4.8 million cases, 9.2% increase from the week prior. As you can see, that is trending downwards. This was as of yesterday, so we've tested over 58.2 million tests have been conducted here in the United States. 2,387,000 people have recovered, 10%. That's certainly different from the 86% that I reported out last week, but I think from the last week prior, I think more states are actually now reporting the number of recovered. So that was one of the reasons why the big jump. In terms of fatalities here in the United States, 159,726, 5%. That is a marked decrease from the week prior that I reported out. Back here in Wisconsin, 56,940 cases, 11.5% increase from the week prior. And as you can see from the other weeks, the trend is going down here in Wisconsin. The number of recovered, 46,323, 14.6%. That is pretty consistent. We have that 35%, but that's mainly from that initial surge from July 5th. Now we had a huge influx of recovered, and now it's been pretty consistent. Number of fatalities, 970, 6.5% increase. So that gives kind of a quick overview. Next slide. If we are looking at the Indian health system, there are 12 areas. They're all broken out, as you can see in this map. There are 573 federally recognized tribes, American Indian Alaskan Natives, and there is an estimated 5.2 million identified American Indians and Alaskan Natives here. 2.6 million actually utilize the Indian health system. And I think everyone needs to keep in mind that not all natives reside on their respective reservations, but that 70% of natives live in urban areas. So that's important to keep in mind as we go through the numbers. And so let's go right into those numbers. Yes. No. Jeremiah, they can't see the slide. There you go. So this is the Indian Health System, Indian Health Service reporting out as of August 4th. So you can see as you go down, just quick view, Albuquerque, Great Plains area, Nashville, Navajo, Oklahoma City, Phoenix, and Portland have numbers in the thousands to Navajo in the 10,000 range. But as we kind of peel back and look at trends over time, so I've been able to consistently do this for this group every week, at least tally the numbers and what has changed over the prior weeks. And so as you go down August 5th, you can see the change that has been occurring. Alaska's has taken a pretty significant uptick in the number of cases. The Bemidji area, that's including Wisconsin here, has an uptick. Nashville and Oklahoma City continually show high numbers. That's different from the week prior. So you can see the week prior highlighted yellow, the number of cases, and as you go down at the very bottom, you can see the total number of cases from the week prior, 2,467 new cases from the week prior, comparative to the 2,793. So as you can see, within the entire Indian Health Service system, the trend is going downwards. So as you go across, and you can see where the percent change, you can see the changes are going on. So when we look at the bottom line of percent change, 7.85% change from the week prior, I highlighted the areas that have shown the percent change in yellow above that average. And so despite the number of cases, some areas have shown significant drops. I excluded Phoenix in this week's mainly because the number set that was provided didn't align with that was consistent with the week prior. So I excluded Phoenix area for this week only. So as you go, there's the percent positive. This is the number of tests positive per test conducted. You can see that the average for the Indian Health Service is 5.2%. And as you go up and down each area, you can see where the percent positive rates are. And Billings has a high, as well as Oklahoma City, and now Tucson has above average. So looking at how do you put this all together, you really have to look at the numbers and put that in context and trend them over a period of time, which I've done for you. So when you look to the far right, you can see that Alaska is on an upward trend, the Bemidji area is on an upward trend, Nashville and Oklahoma City. Everyone else is either maintained or plateaued, or actually showing a decrease in the number of cases. And I want to at least take a second here to highlight Navajo, the Navajo area. So as you can see, the numbers from prior weeks, they really had some pretty significant numbers over time. And in this past week, they've only had 227 cases. So the Navajo area is definitely has made inroads into curbing the number of cases, which is really important. So for Navajo, that trend is decreasing without a doubt. Next slide. So just to get into the areas a little more specific, I highlighted Bemidji, Great Plains, and the Billings area. And this is really looking at the individuals that actually utilize those federal, tribal, urban programs in those areas, and how they report versus how the state health departments report out numbers, native cases. So I took the liberty to just showing 773 cases in Bemidji, and then what the percent increase from the week prior within the Indian Health Service system. So as you can see, there's a 17.1% increase from the week prior, which is pretty consistent from last week. And so the rate's fairly high. Looking at all the state websites, you can see the numbers of 571 for Wisconsin, 504, 351, 261. So as you add those all up, you see that the total number is 1,687. So this is significant because, as I mentioned, not all natives reside on their respective reservations. So it's important to know because it does have an impact when you start looking at overall numbers and how this all works out. So when looking at the health health websites, 165 new cases from the week prior, and a 10.8% increase from the week noted. So as you go, Great Plains, very similar. IHS, the Federal Tribal Urban Programs have a much different number than what the websites show. And North Dakota does not report out on demographics, specifically race or ethnicity. And then obviously Billings, although they're closer, there's still a discrepancy in the numbers. So you can see that, overall numbers you can look at within the Indian health system, and you can look at the overall statewide. So next slide. So I wanted to take just a quick roundabout view at our region, not Bemidji area, but just the entire region. So when we talk about Wisconsin, as I mentioned, 11.5% increase from the week prior. That's 5,891 new cases from a week, 841 cases per day in the state of Wisconsin. COVID cases are being confirmed. In Michigan, they have a 7% increase from the week prior. And as you look through the trends, they have been trending upwards pretty consistently for the last 6 weeks. 4,535 cases, 648 cases per day they are seeing currently. In Indiana, 5,676 new cases, 811 cases per day. That's an 8.8% increase from the week prior. They perhaps have peaked and maybe are going down on the other side of their curve. We'll see. In Illinois, over 11,000, almost 1,600, over 1,600 cases per day, 6.5% increase from the week prior. And you can look at the trend there. They appear to be also following Michigan, and they are trending upwards as well. In Minnesota, 9.1% increase, 4,832 new cases since last week, 690 cases per day. So you really get a sense of states who is peaking, who is flat, and who are really surging. And that just gives you a broad overview of how the states are doing overall. Next slide. So we'll get into each state specifically with regard to the tribes and their respective counties as a proxy. As you go up and down the counties, you can see that there are definitely upward trends in certain areas and in certain counties, and flattening or decreases ongoing as well. One of the things that I've noticed over the last several weeks is that the northern and kind of mid-central counties with respect to Lakeview, Bay Mills, Sault Ste. Marie, their numbers are increasing. And I've noticed that over the last several weeks that although their numbers are low in comparison, but in respect to their counties and the reservations, their numbers are increasing. So they've had reported out 351 native cases. That is 29 cases. That's a 9% increase from the week prior. And as you can look at the trend of numbers, at the bottom here, 9%, 5.6%, 4.4%, you can see that trend is actually going up for the native population. So you may be able to kind of delineate, infer that perhaps these upward trends in these counties with those respective tribes, that those may be the areas more dramatically hit. So definitely an upward trend for those respective counties. Next slide. As we look at Minnesota, Minnesota and the tribes with their respective counties have remained relatively flat. There's only a few areas, but these are tribes that are fairly highly populated in their respective counties. So it's hard to infer if there's been any dramatic change, but There are cases, and as you go down the counties, you can see that Prairie Island and Fond du Lac are the really significant areas. In Scott County and Shakopee, that's right outside Minneapolis. That's a highly populated county. So that's something that 190 new cases from a week ago. Take that with a grain of salt. Now, overall, Minnesota's Department of Public Health has reported out 504 cases. That's 49 cases from new cases from the week prior, 10.7%. And as you can see in the state of Minnesota, the native trend of cases appears to be going down. So Michigan trend is going up, Minnesota trend is going down. So good news for Minnesota. If we go to Wisconsin and we look at the tribes and their respective counties, you can see that a good portion of the counties have shown an uptick in numbers, specifically in the Shawano, Menominee County, Outagamie, and Brown County. Obviously have higher population. That's the Oneida tribe. And then we get into Lac du Flambeau and LCO, Lac-Courte. Those numbers are going up. Winnebago, the Sauk County and Jackson, they, and specifically Sauk County, has shown a pretty dramatic increase. And so almost 100 new cases from the week prior. And then St. Croix area with the multi-county 182. So definitely some upward trending going on in those areas. And the Wisconsin Department of Health Services has listed out 571 cases. That's 67 new cases from the week prior, 13.3% increase from the week prior, which I noted as being 15. So you can actually see the trend in Wisconsin. The number of native cases appears to be on a downward trend. So Michigan, upward trend, Minnesota, Wisconsin on a downward trend. In Illinois, not a lot of change. They've had several cases, 241 cases. It's 11 new from the week prior. But again, I just wanted to include this because we do have a sister agency, the Chicago Urban Indian Health Program there. So I just wanted to make sure that we include them as they're part of our region. Next slide. So this is just a little more detail on the number of cases in Wisconsin. So 571, 67 new cases, 13.3, and the number of deaths, the fatalities have remained unchanged for almost 9 weeks now. There's been no new reported deaths for the native population, at least in the eyes of the Wisconsin Department of Public Health. So that is a good trend. Next slide. Demographics, looking at age distribution. As I mentioned, the distribution is primarily in the, or at least the high rates are primarily in the 20 to 29-year-olds. I've been trying to keep particular attention to the 0 or newborn to 19-year-old age group. I did notice a slight uptick in the 10 to 19-year-old cases from the week prior. So in that red box, you can see the days that I've reported out and the percentage, or at least the rate of COVID cases in those age groups. And I included the 10 to 19 several weeks ago because I noticed that it had been slowly changing as well. So they are now up to 10%. That's up from 8% 4 weeks ago, up 2% from 8% 4 weeks ago. And obviously, the majority of cases are in that 20 to 29-year-old age group. So just wanted to make that as a highlight. Next slide. And this is really just trying to highlight what I'm seeing in other states. And Minnesota obviously follows that trend. Illinois follows that trend. Indiana follows that. Michigan is slowly following that trend. It may take a little longer to actually have that bar graph show that, but about 2 months ago, this was mainly to the right. But over the last month, it's been slowly going back and being more consistent with the other states that I'm seeing. Next slide. I also wanted to include 2 other states, South Dakota, Montana, obviously high populations for natives. But again, we're seeing this, that age group distribution, that younger age group, especially the 20 to 29, as well as in South Dakota, as well as in Montana, very similar distribution. So I just wanted to make sure that people know that. Back here in Wisconsin, our now 7-day average is 841. We've had in the last 3 weeks some pretty significant numbers, well over in the thousands. It seemed for a couple of days there that we were setting new records almost every day. However, as you can just kind of glance and look at this, we may have reached our peak in Wisconsin. And I think that's important to know because so school is going to be starting and we kind of want to know how things are trending out. This week will tell us a lot more as the numbers go on, and I think next week, Tuesday, will tell us even more if we're certainly on that trajectory of going down. Next slide. Bringing it back here to Milwaukee County, the number of cases, 20,251. The fatalities, 389. And as you look at that center map, that is Milwaukee County. It's kind of split the highway north to south side. And as you can see, it looks pretty consistent, pretty well distributed throughout the entire county. There's really nowhere that's spared. Every zip code and every district appears to have cases. A little bit more concentration only because on the south side, only because I think there's 2 main areas that are really doing a lot of testing. We're one of them, and another health center, as well as the National Guard. So a lot of testing is going on the south side. Next slide. I wanted to bring this slide up because you know, people are kind of wondering what's going on in Milwaukee County. You know, a number is a number, but I think when you put it in context, I think it makes a little more sense. So this is the number of cases, daily cases that are being reported out in Milwaukee County. Now, in May 18th, at that time, that was a record for Milwaukee County, 354. And then as you see the kind of the scooping downwards, the numbers continue to go down, 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 down. And it's at one point we were getting less than 50 cases per day. And then just like the rest of the state, the number has gone up and up and up and up. So on July 8th, Milwaukee County set a new record of 371. And then as you see, since then, the numbers have gradually gone down. And as of 2 days ago, August 3rd, the number of cases here in Milwaukee diagnosed was 169. So I guess when you look at that number of 169 in comparison to, in the context of Milwaukee County as a whole, not just Milwaukee, the city of Milwaukee, but Milwaukee County, we're talking about 1 million people that reside in Milwaukee County. And for us to have a daily count of 169 seems pretty small pale in comparison to like other cities or other states, specifically like New York City or Houston or Dallas or even in California. So, when we're reporting out, cases of 800, 600, and nearly a third of those cases are in Milwaukee. When you look at the number of 169, it doesn't seem like a whole lot when you put those numbers in context. So, at least here in Milwaukee, the trend is definitely going down, and it has been going down ever since July 8th. So that is good news for Milwaukee County. Next slide. And this is really looking at the demographic breakout here in Milwaukee and the number of cases. As you go to the far right, 79 native cases here in Milwaukee. That's 3 new cases from the week prior. So the numbers have not dramatically increased. So let's, next slide. So I wanted to highlight this again as a reminder. When it comes to symptoms of COVID, I know we hear a lot about the triad of fever, cough, and shortness of breath. That may be true for a lot of the cases that report to the ER, individuals that go to the ER, people who get admitted. Those are pretty significant symptoms, especially if you need to get hospitalized and if you are admitted to the ICU. But over time, what we're finding out is that there are a lot more symptoms ongoing that show up in the kind of the moderate to mild, or even what people may call asymptomatic, maybe just having at least some kind of a symptom. So headache, these are symptoms that would not necessarily get you to go to an ER urgent care to be evaluated. So we're talking about headaches, maybe some body aches, runny nose, mild sore throat, loss of smell, loss of taste. If that's all you had, you're not going to the ER, or you're definitely not going to get admitted because you don't have any other symptoms. So you can see that there's an entire list of symptoms that go along with COVID and not, so be mindful that other symptoms that wouldn't necessarily lead you to go to the ER, you could possibly still have the virus. So next slide. I want to introduce a couple new things that I've been seeing. Now, CMS has, along with CDC, has put out papers and kind of giving updates as to what they're seeing. Now, what I'm showing you here is the Medicare population. So obviously these are older, an older generation. But I wanted to highlight what's being seen when I talk about, high risk. What does that mean? What specifically does that mean? And we're talking about chronic care conditions. So I wanted to bring this slide up because it really gives a better sense of what kind of chronic care conditions that we're seeing of people that are being admitted to the hospital. And right off the top, high blood pressure is the #1 chronic condition that we're seeing that are being admitted to the hospital, followed by high cholesterol, and then underlying kidney disease. So this could be mild kidney disease, moderate kidney disease, or people who are actually on dialysis or end-stage renal disease. We have diabetes, anemia, ischemic heart disease. So a lot of these, top 5, 3 of these top 5, 4 of these top 5 or 6 actually revolve around cardiovascular disease. And so when I talk about cardiovascular disease, I'm talking about high blood pressure, high cholesterol, diabetes, ischemic heart disease, or people who've had heart attacks or bypass surgery. That's what we're talking about. And as you go down the list, you can see that they become fewer and fewer as a leading cause of hospitalization. So I wanted to bring up 2 things, which I thought was interesting, was COPD. Now, I talk about chronic conditions, people with underlying lung disease, but underlying lung disease, having COPD and asthma, you would think, with the virus and this being respiratory, that, that would be much higher up on the list. It actually is on the much lower end. And so there's no good explanation as to why the hospitalization rates for chronic conditions, COPD and asthma, are down further on the list. But again, it is what what they're seeing in the Medicare population with chronic conditions. This is what they're seeing. People with cancer, people with stroke. Osteoporosis is on this list. Now, that doesn't, I guess, this would be calcium, demineralization of your bones. And now, majority of people over 65 have some level of osteoporosis, and as you get older, it becomes worse and worse. So, but having a chronic condition of osteoporosis wouldn't necessarily lend me to think that if you just had that would be a risk of hospitalization. But obviously they list it, and I just wanted to highlight that. When we talk about conditions, this is what I'm talking about. Next slide. I know this is a little busy of a slide, but I wanted to highlight the right lower portion of this. And this is Medicare population of COVID-19 patients that are being hospitalized. So the rate of hospitalizations, and this really hones into the demographics and race of what we're seeing nationally. So this is a rate per 100,000. So this is the number based on population. And when we look at that middle, it says Native, Asian, Black, Hispanic, White, and other. We hear a lot about the African American population, and we also hear a lot about the Hispanic population. There's certainly a greater number of cases in these two demographics. But when you look at the hospitalization per 100,000, African American, number one. Number two is Natives. And that's a little interesting because, I report out these numbers. They don't seem significant in comparison to other demographics, but it is significant when we talk about the Native population, because on that previous slide I mentioned, we talk about chronic care conditions. Natives, as we know, deal with a lot of chronic care conditions: high blood pressure, high cholesterol, diabetes, ischemic heart disease, cardiovascular disease. So these are, there are high rates of this within the Native population. So this makes sense to me. And this is the actually first, notation of how that actually looks. So, well, who gets affected more? Yeah, there are more cases, but when it comes to hospitalization, where I think it counts more, this hospitalization rate in this Medicare population certainly brings that to light. And so that's important for people to see and understand that, yeah, we are still part of the picture here. We don't get talked about as a Native population, but we are number two in terms of hospitalization rates. Next slide. So I talked last week about I wanted to breach the subject of mental health, and in reviewing a lot of what's out there, it's pretty scant. There's not a lot of information. There's not a lot of studies. Now, I think everyone would, if they think back in March, early April, and we all remember the countries that were impacted the most. Countries that were impacted the most was mainly Spain and Italy. So as a result of this, we are continuing learning more about what's going on with not only the virus and how it impacts us physically, but this is the first kind of paper that I saw that actually did the San Raffaele Hospital in Milan, Italy, did a study on a population to look at the emotional mental health effects of having the virus and the result of recovering, what they were seeing. And so what they're finding is 60% of COVID-19 survivors may be dealing with these following things. I'm gonna go through each one of these, not just as a result of surviving or recovering from the virus, but their emotional well-being and how they're going to move beyond recovery. And so, as I mentioned, this was a study out of San Raffaele Hospital in Milan, Italy. They followed 402 patients, 265 were men, 137 were women. And after a month of being released from the hospital and being treated for COVID-19, they did clinical interviews and self-assessment questionnaires for each one of these individuals to assess how they were doing at time 0, as well as at time 30 and beyond. So these researchers found that nearly 60% of patients studied scored high at least one of these mental health disorders. And I'm going to go through these. And now, I think this is kind of interesting because as you know, we talk a lot about the physical aspect, the viral impact. You know, we talk about the chronic conditions and the testing and what we should do. But we haven't talked about, what really hasn't been talked about is the impact on individuals after their recovery. And so this study found that obsessive compulsive disorder. Now, we know that we all have gotten to some level of being OCD right now, just to being health and safe and trying to limit our exposure. But what they found in this study is that 20% of COVID survivors actually became more, or they worsened their OCD, which is pretty significant because if people weren't concerned, or if they were concerned and had such a high level of operating methodically, they're doing it even more now. So that was something interesting that I found from this study. PTSD, post-traumatic stress disorder. You know, it's not surprising that there is this trauma because this came out of nowhere, this virus, and it came on so quickly, it really shook everybody. It shook countries, it shook communities and families and individuals to a point where, you know, people who had PTSD prior has made them dramatically, their trauma even more significant, or highlighted their trauma, whatever that may be from prior, to even accentuating even more afterwards. And that, again, that doesn't, I don't think that should necessarily surprise anyone, but I think this kind of puts a number to that disorder. And so this is out of Italy. You know, Italy had that huge surge and impacted their population dramatically. So that's pretty significant. Next page. And so what about depression? So we know that physically COVID-19 has an impact on the brain. We know it affects people who may have lingering symptoms physically, either lethargy or fatigue or chronic fatigue syndrome, and also strokes or TIAs. But in this study, they found 31% of survivors were deemed clinically depressed. And so, again, there's just so much and this is just one study, and I'm sure there's going to be more that is going to come of all of this with time, but this kind of gives you a quick insight into the impact of going through such a traumatic event of being infected, recovering, and then having clinical depression as a result of the virus. So I thought that was an interesting point I wanted to highlight as well. Insomnia. Now, you would think this would be a little odd, given that people who get COVID and get sick, get ill, get in the hospital and have this moment of recovery. But there's this sense of heightened sense of urgency, I think, in everyone. And I think if you're a recovered person, that sense of urgency kind of maintains in your routine. So 40% of COVID survivors were dealing with insomnia. Survivors were dealing with insomnia. Now, why is that? It's hard to say. It could be the result of individuals being hospitalized. I as an internist and admitting people to hospitals, I find it a little interesting when people say, yeah, you'll be admitted to the hospital, you'll get your rest and everything will be fine. Well, yeah, most things generally you do get fine. But I always thought it was weird when people would say, hey, you're in the hospital, you're going to get your rest, you're going to get better and, and do better. Well, I think everyone forgets what goes on in the hospital while you're admitted. There's all kinds of new people, new strangers in and out of your rooms, from house staff to nurses to doctors, to social workers, to counselors, to the billing people. There's always people coming into your interacting, but you also have to take into consideration what actually happens. So people get vital signs taken every hour. They get medications, they come in, they have maybe bags, maybe they get shots, they get pills, and things are, you don't get any sleep. And you're always woken up, you're always interrupted. And so I'm not surprised that people who maybe have been in the hospital for a prolonged period of time, especially if they've been under sedation or under this routine of care, this routine of hospital, being inpatient, that people, now that they're at home, they are still kind of in that same routine and have difficulty sleeping, or if they do sleep, it's only for a couple hours. So 40% suffer from insomnia. That was the next point I wanted to talk about was anxiety. So anxiety, obviously there's such a high anxiety right now, certainly concerning fear of not only getting it, but once you get it and you've recovered, there's always that anxiety of what's going to happen. Is something really bad going to happen, or something? Am I going to die from having this? And so there's that fear, and that ramps up, and it ramps up to a point where, in this study, they found a good portion of post-recovery individuals suffered. And what they found that men fared better than women, and that at least in this paper, they felt that women were more likely to battle both anxiety and depression simultaneously post-recovery. So again, there's not a lot of information out. This is just one study that came out that I thought, we can certainly get into more of this as we move forward. But I wanted to bring this up. And so as we go through, I want to go through these slides, and we'll have some time for a few questions. But again, GLIC provides a lot of outreach, a lot of items, safety kits for home for you and your family to stay safe. We provide programs for domestic and sexual assault. We have programs for our youth. We have preventative and education seminars, virtually. So the one thing I wanted to highlight today is today we actually have our community health fair. We're set up right now. We have a huge parking lot, and we have multiple stations to go through and offer you material and information. And this is literally a contactless interaction. We offer these safer at home kits of bleach, detergent, liquid soap, bars of soap, hand sanitizers, as well as masks. And we're going to be giving those out today between 2 and 5. Everything is drive-through. You don't have to get out of your car. You can stay in your car. So you can, there's 11 stations. You can just go to each one, get information and get a cleaning kit for you and your family at home. So again, please stop by today if you're in the south side of Milwaukee. The next slide, please call us 414-383-9526. If you have any concerns of exposure or showing any signs of the symptoms that I had mentioned, please don't hesitate to call, and we will definitely set you up for a date and time to get tested. I want to leave some time for questions, so let me turn it over to Jeremiah and Mark. We have a few minutes left. I just want to make sure we have some time for anyone who may have a question. You're on mute, Mark.
We do have a question that came in online, and I'll just read it directly. It is something that a lot of folks are dealing with, and that is supporting someone who does have mental health problems in their life. And this is what that support person is wondering. We have a relative suffering from OCD, and yes, it has definitely worsened with COVID-19. The person has more panic attacks and is more clinically depressed. What are some things that families can do to support these individuals, OCD, and that kind of worsening sort of situation that they're observing?
Yeah, and it's unfortunate that this individual not only had the COVID, but it seems like this individual is very consistent with what the Milan study from Italy has demonstrated, the post-recovery. So I think it's important that individuals do connect with their primary care provider. OCD, panic attacks, and clinical depression are not only accentuated, but they're heightened to a point that it's concerning, and I think it's important that they try not to necessarily try to manage this themselves. I think they need to engage in a discussion with their primary, who I would more than likely think would refer them to a behavioral health professional who can start engaging in this discussion. There aren't going to be any set pattern here, because there could definitely be some underlying mental health issues even prior to this, and now it's just being accentuated even more as a result, like OCD, panic attacks, and depression. They may have been there, but having to discuss this in depth, and maybe have to discuss each one, or maybe they're interrelated to all together. But I think a behavioral health specialist would certainly be in order, and there are medications that would help. We're not talking about control controlled substance medications. We're talking about medications that help support individuals that have OCD, that have depression, that have panic attacks, that don't require um, sedative medication. So mental health therapeutic discussions sessions, along with the possibility of therapeutics medications, may be the best approach on helping this particular individual manage and work through this difficult time.
Do you have a question that kind of was outstanding from last week, and that was when we were dealing with the back to school issues. I wanted to articulate that a little better this time, and that is buses. A lot of our young people are riding buses to schools. Either they're going to be going to the blended schools or a full day, depending on the school. For those online, certainly they won't be doing it, but here's the issue the parent brought up. When children get to school and they're on a bus, they're going to get the questions of kind of a COVID-19 screen. Depending on the school that they attend, there might be a temperature kind of screening at the front desk as they're coming into school. But that will not be present with school buses. So as a parent, as a medical person, what are your suggestions when a parent is bringing their young person and to the bus, and you're going to put them on there for that, maybe that 20, 30, 40-minute ride in some cases? What are your suggestions to that parent putting that young person on that ride to school?
Yeah. So just to go back to the mental health and the OCD, obsessive compulsive, the OCD Foundation has a lot of sources that may help the individuals who submitted the questions in support of, and tips on how to help manage people with OCD. Just wanted to bring that out. In terms of the bus ride, I know you talked about schools having pre-screening before entering. I think there will need to be a kind of a heightened vigilance for families before sending their kids to school. I mean, we all know our kids. We all know their little nuances and things that, when they're kind of getting sick and, when they're doing fine. But I think from an independent individual family perspective, I think they really need to pay attention to signs and symptoms of what would a cold be, because a cold in a young person could very well be COVID. And I think that's where parents need to really pay attention to the symptoms that their kids may have. Now, if the kid is feeling down, they're not themselves, they have runny nose, maybe they have a cough, they're not feeling well, nausea, maybe even if they have a low-grade temperature, I would not send them on the bus. I would keep them home and observe them at home for that. Now, if you have a thermometer at home, obviously, if it works and you can rely on it, I would use it. Anybody with a temperature approaching 100 degrees, I would keep that child home. Even if it's less than that, let's say it's 99.6, 99.8, that's technically not a fever, but it could be the beginning of an increase in a fever curve for a young person. So they may not be febrile or have a fever when they're at home, 99.6, but by the time they get to the school, they have a temperature of 100. So I think people really need to be hypervigilant about any signs or symptoms. If they suspect their child may have it, I think they should keep them home. I think if that's a kind of a general rule that all families take, I think we can minimize the risk of transmission.
And just a reminder for those viewing as we close this session out, there was a resource that was shared in our chat. Please go to the chat bubble and click on that, and you will see a post of a very good website for help with from the OCD Foundation on the question we had and more. I also want to say, just from a personal perspective, and articulate a concern from teachers and professional staff in the schools. This is a message to the parents. Please, we need to be better about how we're sending our kids to school. Oftentimes, working parents, when their child is getting sick, the fever is starting to present, they'll give them some Advil just to get them through a part of the morning or the day at the school. And then they say, well, I'll deal with it if they send my child back in the afternoon, or maybe it'll get better. We need to be better. We need to be protecting our educational staff. So when these things happen, the usual let's give something so they can get past the screening point isn't an appropriate way to go. And a lot of parents will do that. We need to be honest about it, and we need to talk about it, and we need to say we can do better. So with that, I'm going to turn it back over to Dr. Ignace for our final thoughts for the day. And again, Milwaukee community, please head out to the Ignace Health Center and check out these stations, their drive-through, and they're ready to help you.
Thanks, Mark, and thanks, Jeremiah. You know, week 14, I know this was a condensed discussion and update, but it's important, and I wanted to breach information that I'm seeing. I know everyone may not get the same information, but I think it's important that we bring this as I see it coming through. There's so much coming out right now, and we'll get into more behavioral health, mental health discussion. We'll definitely talk more about the medical aspects as more papers are coming out, what we're seeing from a medical standpoint, what this virus is doing to people. So I think next week we'll go back to our regular scheduled time, Thursday, every Thursday at 3 o'clock. What I will do is we'll send out information, but until next week, stay safe, protect you, your family, and your community, and stay strong. So thank you for joining us, and we'll see you next week.